From Studio 3C in Rockefeller Center, this is News 4 New York.
All right, moving on now at 4:30, the FDA sounding the alarm on the shortage of one of the most commonly prescribed antibiotics in the country.
Yeah, we're talking about amoxicillin, which is used to treat bacterial infections like pneumonia and bronchitis. So what should you do if you can't find it at your local pharmacy? News 4's Linda Baquero is live from Armonk with important advice. Linda?
And we're in front of a satellite office of White Plains Hospital, and pediatricians here seeing a surge in demand for amoxicillin. Manufacturers now trying to ramp up production to meet that demand. With fewer COVID restrictions and fewer masks, more people are getting sick, driving up demand for a popular antibiotic and driving down supplies. Dr. Samantha Lowe is a pediatrician at White Plains Hospital.
So amoxicillin is used very frequently, especially in young kids, in the suspension form for upper respiratory tract infections, ears, sinuses, strep throat, and pneumonia.
The increased demand for amoxicillin prompting the FDA to alert pharmacists about spot shortages.
And this has to do sort of with some combination of a raw shortage, a raw supply shortage, combined with, as I mentioned, just we weren't using it for several years.
How's everything going?
At Stratton Pharmacy in Scarsdale, Michael Arrow is shoring up his supplies.
I have a personal relationship with my distributors, and they make sure that we're well stocked for the community.
Dr. Lowe says if you can't find the liquid form of amoxicillin, which is what's running low in some parts of the country, there are chewables. Doctors can also prescribe penicillin.
I think the goal right now is actually to increase production, and also there's been some talk of also redistribution.
So if you're looking for supplies of amoxicillin, remember to check not just major retail pharmacies, but your local pharmacy as well.
And I'm sure, like everything else, the levels will come back hopefully sometime soon.
I don't think that this is any reason to panic. There's plenty of other alternatives that we can figure out, or we are able to find it.
And that's the key. Just like with the baby formula shortage, you remember that while production ramps up to meet supply, you may not find it at the first place you look, but pharmacists and doctors say you should call around, ask for alternatives to make sure that you can get the medicine that you need. Live in Armonk, I'm Linda Baquero, News 4 New York.
All right, good information. Thank you, Linda.